I'm here with Dr. Francesco Carones of Italy, and a world-renowned ophthalmic surgeon, but also, curiously, I've just learned that you know Gabbana, of Dolce & Gabbana.
I know a lot of stylists and high executive level people involved with the fashion, just because my practice is downtown Milan, where all the business related to fashion runs. So it's something that I'm very proud of, just because their practice, their job is very oriented in the same way that my practice is. They try to accomplish their clients. They like to satisfy their needs and the way they see themselves. That's pretty much what they do in our practice as well.
Well, you know, and we didn't really plan this. We didn't plan to have the Friend of Fashionistas on here with our program. But it is curious because, you know, it suggests that tailoring outcomes to your patients is important in ophthalmology, as tailoring is important in the fashion world. So apparently we've picked a good metaphor in this sense. But tell me a little bit about how you tailor the new IOLs of today to your patients.
That's the best question that you can ask me, because I'm a big fan of personalizing, tailoring what we have as medical devices, in this case IOLs, for letting the people having exactly what they need. So in terms of tailoring the needs of the patients, and if we refer this to cataract surgery, we have so many IOLs, so many presbyopic correcting IOLs that are performing very differently. Right. So I'm not that guy who says one IOL fits all the needs. I like to implant almost all the IOLs that are available in the market because they have slight differences in performances, and I really like to measure and dedicate to each single patient the best IOL for his or her needs. I don't know if I can comment very briefly on this. I'm using also for this a visual behavior monitoring system that allows me really to measure what distances the patients are using to see, if they are more distance intermediate oriented or more like intermediate near, so as to have not only the feeling but precise measurement of what patients do in their normal life.
It's very interesting. So somebody who likes to read the fine print of a newspaper might be at a certain distance, but then as they're lounging they may, come in different distances and they still want to be comfortable, right?
Exactly. And there is where the need for IOLs providing a very wide range of continuous performances, let's say very far distance down to close or near, is extremely important. Patients are less and less likely to accept compromises, and basically, in most of the cases, they decide to undergo surgery, at least in my practice, not because they really need it. In other terms, the cataract patients that I treat are more likely to do the surgery before they really have a dense cataract. So they decided to have the surgery done because they want to improve their quality of life, they want to enjoy their job, but they want to enjoy their time, their sport activities, their passions, and there is the need for having different distances available with the IOLs.
Now, we talked a little bit about your experience off camera with iHance, with Symphony, and with Synergy. But for example, in this IOL line from Johnson & Johnson, could you explain the differences in each and how each would be better suited for particular patients?
Sure. Let's say that let's set the presbyopia correcting effect of these three lenses, where the iHance is the one correcting the least of the presbyopia, the Symphony may be set in the middle, and the Synergy is going to be the most performing. So, having said that, it looks like that everybody should have a Synergy because it's more performing. On the other hand, we know that rule that says the more spectacle independence you're going to provide to the patients, the more likely you will have to get also the side effects, also the downsides, also the little compromises in terms of quality of vision. So the IOLs is the one with the best performance in terms of quality of vision, yet delivering less spectacle independence. Symphony is pretty much positioned in the middle, and Synergy is the one delivering much more spectacle independence, but with a little bit more on the top.
You know, now we're based out in Asia Pacific, where Symphony has been around for some time. Also, iHance is available in parts of that region. Should patients wait until they get a future technology such as Synergy, or can they also feel confident today with contemporary technology or even modern technologies for Asia Pacific?
Patients should first of all be consulted by someone who's really involved in it, because even though today in Europe we may have a little bit more performing IOLs than Asia Pacific, still a lot of patients will not take benefits from these IOLs just because they're not good candidates.
Right, right.
So all those patients who are good candidates may take huge benefits from the currently available technology like the IOLs and the Symphony, because they are wonderful lenses delivering extremely well when the patients are good candidates and the performances of the IOLs meet the expectations of the patients.
So it's almost like when you think about these lenses, you almost think about the patient demographic rather than what is this technology exactly. It's more about what the particular benefit is to the patient.
Exactly. As we started talking about fashion world where tailoring the patient needs is important, the same may be applied in the ophthalmology field as regards to IOLs. So the IOLs, to give you an example, is a great IOL for patients who are not willing to accept any visual compromises. They want to have a crispy, brilliant, neat vision at all light conditions, in no halos, no glare, no other side effects. Symphony is a wonderful lens for those patients who are basically more interested in intermediate activities and distance as well, meaning computer distance, reading newspapers and books, but let's say 50 centimeters and not closer, because in that case Symphony delivers great spectacle independence at the minimum cost in terms of compromises. If you would be a patient really willing to get the full range of vision and not being happy with a good intermediate, that is the area where I would say maybe wait for the approval for the Synergy in this case.
And Dr. Carones, you said that this week is Fashion Week in Milan.
It is.
So tell us a little bit about Fashion Week as well. What happens during that week in Milan?
Fashion Week is totally crazy because Milano lives on fashion, is the major part of the business. So not only a huge number of people related to fashion are flying into the city, but also tourists are flying in as well. And all those who are interested in shopping are overlapping to this huge number of people. But the funny things to tell is the population that shifts from the typical Italian average size, not too tall, not too skinny, to the typical more Anglo-Saxon oriented body shaping, like tall models, male and female, very skinny, and so for us, not being used to see that kind of beauties around, it's kind of enjoyable as well.
Interesting. Well, I guess the tailors making the suits have their work cut out for them this week in Italy. Surely there's a lot of international orders going on.
It is. It's definitely true.
Interesting. Well, thanks so much for joining our program. We've learned a lot about ophthalmic fashions, the IOLs that are in vogue, and we'll look forward to seeing you in Milan sometime on the runway.
You're always, all of you, very welcome. So looking forward. Thank you.
Great. Thanks so much.
My pleasure.
All the best.